Hi, my name is Tang. Our group is subgroup 11, and we will be present about the drug analysis of perindopril. And there is a case scenario where it happens at Lion Nursing Home in the midnight at 2 a.m. And we found a victim, which is Mrs. Teresa, at the age of 85 years old, and she has dementia and she is bedridden. And this old lady was found lying motionless with shallow breathing and has unusual powder residue found around the victim's mouth. And we asked the investigators, we collect the suspicious powder residues and analyze. And we found out that it is the perindopril. In the next session, we will briefly discuss about what is perindopril, how it affects our body if it is overdosed, and we will present about the scientific analysis via FTIR and SEM.
Perindopril is an angiotensin-converting enzyme inhibitor for treating hypertension and heart failure. It commonly exists as perindopril albumin. It is a white crystalline tablet, and the molecular formula for perindopril is C19H32N2O5 and C23H43N3O5 for perindopril albumin. The core structure of perindopril includes proline derivative. It contains a substituted indole ring, an ester group, and an amide linkage.
I'm Janice. Now I'd like to present about how perindopril is administered in body. Perindopril is taken orally in tablet form and the dosage are 2, 4, 8, and 12 mg depending on the conditions of the patients. Once the perindopril is absorbed quickly in human body, about 30 to 50% are converted to an active metabolite, which is perindopril. This active metabolite is used as relaxation of the veins and arteries, hence reducing the blood pressure. The perindopril is then eliminated out after 0.8 to 1 hour. Thank you. Now I will present the negative impact of a perindopril overdose. An overdose of perindopril can have severe and potentially life-threatening consequences. The most common manifestation is hypotension, a condition characterized by abnormally low blood pressure that can lead to symptoms such as dizziness, fainting, and difficulty in breathing. Additionally, an overdose can result in significant liver damage, heart damage, and kidney problems. As the problem becomes more serious, it will cause death, as in the case discussed above.
The picture below shows the ATR-AKR result of perindopril. After integrating the result, the perindopril contains median absorption near 1000 to 1300 cm-1, which confirms the presence of the ester group. Peak at 1251.24 cm-1 confirms the presence of acid group, and peak at 1561.55 cm-1 indicate the presence of C-double-bond-C aromatic. Moreover, wave number 1642.35 cm-1 shows the presence of C-double-bond or stretching, and wave number 2901.51 cm-1 discloses the presence of CH stretching. Lastly, the further peak at 3282.06 cm-1 confirms the presence of hemming with amide leakage.
So image 1 shows the surface morphology of a material at 5000 time magnification. The scale bar represents 5 micrometers. The image reveals distinct microstructure features that are indicative of the material's composition and texture. Under 5000 time magnification, the shape of perindopril is irregular. So SEM image provides a closer look at the same material at 10,000 time magnification as shown in image 2. The scale bar represents 1 micrometer. This image emphasizes the fine details of the surface structure. The surface is uneven, and there are some particle-like substance deposited on the surface. There are some small cracks on the surface. So SEM image is captured at 20,000 times magnification as shown in image 3. The scale bar represents 1 micrometer. This image emphasizes the extra fine details of the surface structure. The surface is clearly rough, uneven, and granular, and there are some visible particle-like substance deposited on the surface. There are visible small cracks on the surface. The texture reflects the compound crystalline structure. The size and asymmetrical shape of the granules point to a heterogeneous combination.